Are you turning 65 and retiring soon? Regardless of your profession, whether a doctor, truck driver, teacher, contractor, or even a VA veteran retiring, trying to understand Medicare can be daunting. How would you like to find a simple and easy way to understand Medicare and how to navigate through your Medicare options, not having ever to worry about going into it alone? I call this predictable Medicare because it is exact simple to use GPS where you enroll into Medicare for the first time and we help you find the best suited plan for you. Shouldn't every process be as predictable and easy? Now, though that might sound completely obvious, the number of people aging into Medicare today find it a very difficult task because it's walking into the unknown. The truth is, most people start to feel anxious or overwhelmed by the new phase in their life, either turning 65 or retiring soon. Typically, companies offer major medical healthcare coverage to their employees, and oftentimes, human resources will have a premium healthcare medical plan already in place. However, as you approach your retirement years, you may find all of a sudden the ball is in your court to figure out what healthcare plans are out there. Regardless whether you are retired, looking to retire on your 65th birthday, or expect to keep working for the foreseeable future, you'll benefit from knowing key facts about vital programs such as Medicare. Each day, experimentation, hope, and determination meets with the cold unknown and uncertain. With a little luck, maybe folks are able to find their way through Medicare's system and market. Hopefully they find the right plan. Today, or maybe tomorrow. Am I healthy to qualify? Will I get approved? But who really knows? Only seniors with the right tools and way can say that the process was simple and easy, and with the hundreds of clients we have helped, many were able to make sound decisions on their health care and are satisfied. Hi, my name is Henry Amisone, and in the next few minutes I'm going to share with you how I've been able to help folks understand the different parts of Medicare and how to navigate the Medicare market with the tools we have in place. Here's a case study of one of our recent clients. Donald recently turned 65 earlier this year. He is a self-employed and business owner of a construction electrician company. We met at a local grocery store at one of the kiosk stations. We had a great conversation, and the things I heard him say were common themes I've heard others say. Donald mentioned that the amount of telemarketing calls he receives daily, also the pile stacks of mail from private healthcare insurance carriers, all wanting his attention, stating what sets them apart in the Medicare market. For Donald, the whole experience was overwhelming and a bit of information overload, trying to make sense of all the plans available to him. Long story short, we scheduled an appointment to meet at the office. I met with Donald and his wife. We went over his options, and in the end, Donald decided to go with a Medicare supplement plan and a prescription drug plan that not only met his requirements for medical and prescription, but it was affordable and within his budget. They were very happy, and I was glad I could help. That's just one of the many success stories of helping our clients navigate through the market for their Medicare solutions. As brokers, we represent most carriers, so we're able to offer and share what products best fits your needs. First, we will learn about Medicare basics so you can understand the coverages and benefits. Then, I'm going to share with you the biggest mistakes that most Medicare beneficiaries make when it's time to enroll into Medicare and whether they understand Part D and if the prescription drug plan is required with their original Medicare Part A and Part B. Let's begin. Medicare is a federally funded program that provides healthcare coverage for Americans aged 65 and older, including people with certain disabilities and or end-stage kidney failure. Since 1965, it has helped millions of Americans pay for their healthcare services they need. You most likely have already been paid into the program through Social Security. The best time to sign up for Medicare is during your initial enrollment period. This period begins 3 months before your 65th birthday, includes the month that you turn 65, and ends 3 months later. There is a 7-month window in which to enroll into Medicare for the first time. You must either go to your local Social Security office or apply online at ssa.gov. Medicare Part A is hospital insurance that covers inpatient hospital stays, care in skilled nursing facilities, hospice care, and some home health care services. Medicare Part B is medical insurance that covers doctor services, outpatient care, medical supplies, and preventive services. When are you eligible for Part B? Anyone who is eligible for premium-free Medicare Part A is eligible for Medicare Part B. In the initial enrollment period, you may choose not to sign up for Medicare Part B if you are currently covered under your employer group plan, either on your own or through your spouse's employer major medical plan. If you are still working, you should check with your health benefit administrator to see how your insurance would work with Medicare. After your employer health coverage ends or your employment ends, you have an 8-month special enrollment period to sign up for Part B without a late penalty. Can there be a late penalty for Medicare Part B? The answer is yes. Though Medicare Part B is optional, if you delay Medicare Part B enrollment, then you'll have to wait until the next general enrollment period. You have from January 1st through March 31st to enroll. However, coverage will not begin until July. In addition, you'll have to pay a penalty of as much as 10% above the standard premium for every 12-month period that you do not have coverage when you were first eligible. So, it is very important to understand your Medicare Part B options and its impact if you delay Medicare Part B enrollment. Here's a vital information that people must know when entering into Medicare. Original Medicare only covers 80%. The 20% is left to you to take care of. We'll go over the options that you have later after a case study and going over Part D, so stay with me. The two biggest mistakes happens when individuals aging into Medicare forget to enroll into Medicare during the initial enrollment period, or they do not enroll into Medicare Part D for prescription drugs during their IEP when first qualified to do so. Medicare can be costly if you don't take the time to understand your options. Here's another case study. We have a resource partner that is a nurse director for a senior retirement community in Seattle, Washington. Let's call her Judy. An unexpected event occurred where Judy's husband, let's call him Nick, suffered a stroke. Both Judy and her husband Nick have original Medicare Part A and Part B. However, Judy has an employer group plan in addition to her Medicare that covers both medical and prescription drugs. Nick was not included on her employer plan. Hospital stay costs, medication, doctors and services, Nick's outstanding bill accumulated to over $13,000, which is the 20% that Medicare did not cover. So client reached out for help. However, because Nick has been on Medicare for a few years and had missed the annual election period, which ended on December 7th, Nick did not qualify for a special election period that would have allowed him to enroll into a Medicare Advantage plan that included a Part D prescription drug plan. So the outcome, Nick will continue to pay 20% out-of-pocket expenses with original Medicare until the next open enrollment period. That's how bad it can get for those who do not know Medicare basics and do not have no one there to help. And unfortunately, that is just a reality for some, which is why it is our goal to get help to these type of folks now and not later. Is Medicare Part D a prescription drug plan? Yes. Medicare Part D is offered through private insurance companies. Now, here's a very important question. Are you required to enroll into Medicare Part D drug plan? The answer is no and yes. No, because Medicare Part D is optional. You can't opt out enrolling into Part D. However, on the flip side, yes, it is required in the sense that if you delay enrolling, you will be assessed a penalty that is equal to 1% base beneficiary premium each month that you are not enrolled in Part D. It is strongly recommended that you enroll into Medicare prescription drug plan when you are first eligible for Medicare, and you will not be subject to a late enrollment penalty. What if I'm still working? Do I need a Medicare Part D plan? The answer is no. If you already have a prescription drug coverage through your employer, your insurance plan should send you a letter telling you whether or not the company's coverage is credible, meaning if it is equal or better than what Medicare is offering. If it is credible, then you won't have to pay a late enrollment penalty if you decide to switch to Medicare Part D later. There are two main ways to get your Medicare options. First, Medicare Part C, referred to as Medicare Advantage Plan, and Medicare Supplement Plan. Best time to sign up for Medicare Advantage Plan or Medicare Supplement Plan is during your 7-month open enrollment period. Your plan will start the first month in which you are 65 and enrolled in Part B. Medicare Advantage plans are generally organized as Health Maintenance Organization, HMOs, or Preferred Provider Organizations, PPOs. Medicare Advantage may include Part D and often with no added premium. Medicare Advantage plans have service areas and offer nationwide emergency coverage. Medicare Supplement, also known as Medigap, have benefits that are standardized by the government and offered by private insurance companies. Medicare Supplement plans are designed to help pay for some of the out-of-pocket costs Medicare does not cover. This chart shows the standardized coverages with the plans available for you in your area. The difference with the plans will be in the cost of the monthly premium and the different carriers offering the plans. Learning Medicare Basics Part A, B, C, and D are the same fundamentals that I use to assist clients that may be overwhelmed or confused in understanding Medicare for the first time. However, once clients are educated and comfortable with the do's and don'ts of Medicare, I find clients are much happier and well informed. Does it mean more questions down the road? Absolutely. But as broker agents, we are committed to giving you the best level of customer service you can expect. We can help you understand Medicare supplement plans and how it works, as well as compare plans and help you choose the right one for you. Now, the best thing about this process is that it's simple and easy. In the end, our clients will have a plan that meets all their specific needs. With industry experience of over 20 years combined in Medicare healthcare markets, people can trust and know they are in great hands. For that reason, I am grateful to have helped hundreds of clients make this transition from employer plan to their individual health plan. I'm able to help make this process easy for my clients, at the same time working together in finding the right plan. Here are just a few testimonies from my clients. Ricky says, I've been with Henry for over 5 years, and he's been there for me whenever I needed questions answered. I had no problems getting a hold of him. Another client, Dwight from Virginia, says, I thought I was good, but thanks to Henry's patience with working with me, I now have more coverage with some additional benefits to go with it. Thanks, Henry. One more for the road. Teresa of Seattle says, I wasn't sure what plan I should go with, but Henry gave me options to choose from, so I went with the best one that I liked. Simple. Definitely appreciate these comments. So now what? The first step is to complete a short survey. The information will help me assess where you are in the Medicare process. Secondly, you'll be taken to my calendar to schedule a call where we can determine where you might need help at. Please understand the window to take action won't be available long. 7 months to be exact. However, as you already know, this time frame can pass us by before we know it. In my experience, I have found first-time Medicare enrollees working with me are able to make decisions quickly and with confidence with their Medicare option choices. Not to mention, they're most likely to get the results they expect and likely to become clients in years and years to come. Chances are you don't know where to start, and you can do it the hard way, or do it simple and easy by working with me. Because each client has a unique situation, a specific and custom tailored strategy will help you solve the 2 biggest problems that most clients face. The call will take about 30 minutes. You'll be speaking with me personally, and I will help you identify exactly where you are at and help you understand each step of the process. Understand the networks in your area and the plan highlights. Who is this for? Folks who truly value protecting themselves sooner than later and want to get on with life. Who is this not for? folks who make excuses and complain, folks who are stuck in the information gathering mode, not prepared to take action and get results now. Knowing that we are a good fit is absolutely crucial because I want to get all my clients results and work with them for the long term. To do that, I need to get them an affordable and quality plan very, very fast. There are some clients that I just cannot help. And if that's the case with you, I'll be 100% upfront and suggest somebody else or maybe an alternative. So complete the survey after this video. Then you'll be taken to my calendar and you'll be able to schedule a time with me to conduct a no-cost consultation. At the consultation session, we will see if I can help you and see where you are at with your Medicare process. Then lastly, see if you're ready to set up, commit, and take massive action to get what you're here for. This is where we will really start working together to figure out what you want and how to make it happen the fastest, most predictable way. At the end of the call, one of two things will happen. You'll be a fit, and I'll extend an invitation to work with me as one of my clients, or it's not a good fit, and that's totally okay too. Either way, you receive an insanely valuable strategy session and will walk away with a newfound clarity of exactly where you are at right now in making your health care a priority. Or you'll realize that together with the exact next steps necessary to take action, you'll be with the right plan that works to your benefit. It will be the most valuable 30 minutes you invest in you this entire year, so that you can enter your retirement years with confidence. So go ahead and click below to reserve your spot now and follow the instructions on the next page.